perfusion is normal, but there is less ventilation or no ventilations, right? And what do you mean by dead space? Just opposite of that. এগুলো মনে রাখতে হবে. Just examples of this trachea. This ventilation is very good. We are taking breathing. Okay. What are the early features of acclimatizations of high altitude? কে বলতে পারবে? Just come in this point. When you are going to the upward and high altitude, then what will be your changes? At or doing? বলো. হ্যাঁ, আমি কি বললাম? অ্যাক্লিমেটেশনের ফিচার। অ্যাক্লিমেটেশন কি কি হবে বলো? হাইপার ভেন্টিলেশন হবে একবার, ঠিক। রেসপিরেটরি অ্যালকালোসিস, ঠিক। কেন রেসপিরেটরি অ্যালকালোসিস হবে? কেন কমছে? কেন ভেবে বল। H+টা CO2 ওয়াশ আউট হচ্ছে, আমি হাইপার ভেন্টিলেট করেছি, দেন কার্বন ডাইঅক্সাইড অলসো আউট। আমি অক্সিজেন নিচ্ছি, উই আর টেকিং অক্সিজেন, বাট we are washing out our carbon dioxide, and carbon dioxide in water is H2CO3, then H+. Then it will again, now you tell me what are the partial pressure of O2 where this hyperventilation will be occurred? Stimulations. By which receptors? Peripheral chemoreceptors. When the partial pressure O2 is less than 60 millimeter of H. Remember all throughout life. When this is hyperventilations, then again it will cause hypoventilations. Why? একবার hyperventilation হলো, then again it occurring as a hypoventilation. Why? কেন হচ্ছে hypoventilation? কেন হচ্ছে? Carbon dioxide is washing out. Is possible? Sit down. If it is washing out, then H+ will decrease. No confusion. But this H+ is a main stimulator of the central chemoreceptor. So that will be decreased. If it is decreased, then DRG, VRGs of all are decreased. And signal for the hyperventilation, that means contraction of the diaphragm and contraction of the intercostal muscle will decrease. So that will cause acclimatization period. It will happen that first hyperventilations followed by hypoventilations, then again hyperventilation, then going on. And in these cases, what is happening? That is respiratory alkalosis. Now, what will body will do for this respiratory alkalosis? কি হবে এরপর? এসে মানে কোথা রিলিজ হবে? কিডনি. After how many hours? By how many days? After the 10 to 12 hours, the kidney will come. Then what are the other acclimatizations? হ্যাঁ, কেন ভাস্কুলারিটি কেন ইনক্রিজ করবে? সেলের অ্যাক্টিভেশন ভাস্কুলারিটি ইনক্রিজ করবে। হ্যাঁ, একটা পার্ট আছে, বিকজ অফ দিস হাইপক্সিয়া, the peripheral vasodilatations and pulmonary vasoconstrictions, and that will cause a recruitment of another vessels. আর erythropoietin রিলিজ করবে। কেন? Due to the effect of hypoxia inducible factor 1 alpha. From the kidney, it will release or productions of the EPO, and this EPO helps us for synthesis of RBC, and these RBC carry hemoglobin. So lots of hemoglobin means lots of hemoglobin that will carry our oxygen or release the oxygen in the required time. তাই তো? These early phase of acclimatization is very much important, and it is oftenly asked in exam as well as in your clinical based exam also. যে পেশেন্টটা দেখা গেল pH এত আছে, pH means 7.4 is our normal pH in our blood. Normal pH is our 7.4. If it is less than 7.4, it is called acidosis. If it is more than that, it is called alkalosis. So respiratory alkalosis, how it can come in your exam straightforward. In explain why the early phase of acclimatizations happens with the respiratory alkalosis. Your answer will be like that when you will ascend in high altitude, then partial pressure of O2 will decrease. Whenever it is decreased, if it is less than 60 millimeter Hg, then our peripheral chemoreceptors like glomus cells, aortic body, carotid body, within these bodies there are glomus cells, type 1 glomus cells are there, and they have oxygen sensitive potassium channels, and then there are the stored vesicles of dopamine, and these dopamine will release into the nerve terminals, then it goes by the vasovagal or pharyngeals or glossopharyngeal and vagus nerve. And these vagus and vasovagal and that is your glossopharyngeal now will go into the কোথায় যাবে কোথায় যাবে হ্যাঁ DRG VRG যাবে as well as in case of your pneumotaxic center as well as apneutic center also, and that will create, if need, that there is a hyperventilation need of hyperventilation, that will stimulate the DRG and VRG, and then coming password towards spinal cord, C3 C5 root value, it helps for the diaphragm contraction, and T1 to T11 it helps for the contraction of the external intercostal muscles. So contraction will be there and ventilation will be there. That is called taking oxygen to increase our partial pressure O2. Simple. এই কথাটাই বারবার নিজেদের মধ্যে বলতে হবে, এই যে procedures. So then after the hyperventilation, we are washing, or that person washing is his or her carbon dioxide. So now carbon dioxide is decreasing means the formation of carbonic acid will be less, then H plus will be less. If it is less, then H plus ion is the main stimulator present in the CSF, and then main stimulator of the central chemoreceptor. So if it is less, then the receptor stimulation will be less, and that will decrease the stimulation of the DRG and VRG. এই যে নিচের দিকে নামছে, it will decrease the contractions and intercostal muscle contractions will be decreased. So there will be hypoventilations. So hyperventilations followed by hyperventilation is going on. বোঝা যাচ্ছে? এইগুলোই খাতার মধ্যে চাই, লিখতে হবে, আর কিচ্ছু নেই। The neural control means completely peripheral and central chemoreceptors as well as আর কি কেমো বললাম, পেরিফেরাল বললাম, নিউরাল বললাম, আর কি? আরে বল না রে বাবা, কি বলতে চাইছিস? মেকানোরিসেপ্টরস, প্রোপ্রিওসেপ্টরস, রাইট? আমি যে এক্সারসাইজ করব, the joints are moving and so the J receptors will be stimulated and that causing the hyperventilations. The special orientations, proprioceptor receptors are there. যে আমি কোথায় আছি, the proprioceptors is acts for your special orientations. That is also important for your ventilations. Now come to the your clinics, proper clinics. A patients come with breathing pattern like that. Respiration decrease, increase, and then apnea. Then again it is going on, decrease, and again pause. This is apnea. এই পিরিয়ডটাকে বলা হচ্ছে apnea. And what is here? It's happening what? That is increasing your respirations, depth increasing, then followed by decreasing. তাহলে কি হবে জিনিসটা? Stop. Then again. So increasing and then decreasing, then pause. Again I am increasing. This is very important. Any patients come in your OPD with such type of breathes, that means you can say that there is something is happening in the kokuthai, pons and medullary region, that may patients come with strokes, tumor, intracranial pressure, head trauma. But that is called Cheyne-Stokes breathing. That is called Cheyne-Stokes breathing. Cheyne-Stokes breathing is very important for your short note, and as well as it is clinical applications are what? Clinical applications is for your head trauma and brain ischemia, or you can say the cerebral stroke. Patient come in your OPD saying that the patient কিরকম একটা করছে, the respiratory problem was like that. then stop for 10 seconds. Suppose this is your 10 second, this is your 10-second stop, no breathing, then again this increasing, then again decreasing, then again stop, then increasing, then decreasing. So in these fashions, Cheyne-Stokes breathing is going on. So this is your abnormal breathing. Now, a such type of breathing we came across every day as a pediatricians of infant, mainly up to the most of the cases within the 4 months or after the 1 week of age. একটা ডেলিভারি হওয়ার পরে পেরেন্টসরা আমাদের কাছে অনেক সময় আসে, স্যার এর ব্রিদিং নিচ্ছে বাট দ্যাট উইল অ্যাবনর্মাল টাইপ, পেটটা প্রচুর ওঠানামা করছে, নিয়ে আবার কমে যাচ্ছে, নিয়ে মাঝে মাঝে বন্ধ হচ্ছে, দ্যাট ইজ অ্যাপনিয়া. সো পেরেন্টস আর অ্যাংসাস, দে আর কামিং, বাট ইউর নলেজ শুড বি দ্যাট ইজ কল্ড পিরিয়ডিক ব্রিদিং, and periodic breathing, physiological periodic breathing is there because they are immature neural centers are there, right? So in that case also such type of breathing may came across in infants. So when the periodic breathing, it is called periodic breathing in physiological conditions. Cheyne-Stokes breathing is called in pathological conditions, that is called head trauma and ischemic brain tumor, intracranial pressure high. In these cases this is happening. So periodic breathing in infants is normal. এরকমই করে, পেট বেশি ওঠানামা করছে, আমাদের কাছে আসে, আমরা এই ধরনের কেস পেলে খুব আনন্দ পাই, কারণ কিছু করার নেই, তাই তো, কিছু করার নেই, অথচ ফুল ফিজ, 10 মিনিটের খেলা, 10 মিনিটে তাদের আমি যখন বুঝিয়ে দিই এরকম করে একে যে এরকম করছে, বলে হ্যাঁ স্যার এরকম করছে. সো দে reassurance is the treatment. The parents should reassure that this is normal pattern, simply 10 minutes. But if you don't knowledge that from the beginning of your first year class, then you have to, you will think that. But this is due to your immature, infant's immature neural control system. That is called physiological periodic breathing. So any questions related to periodic breathing, etc., always think like that. There is increase depth, inspirations, expirations, then decrease, increase, then decrease, then pause, then again increase, decrease, and pause, right? So what is happening here? Tidal volume is changing, right? Here what is happening? This curve means what? Your tidal volume is changing. So in the depth, increasing means tidal volume is taking increasing, and then decreasing means our tidal volume is decreasing. So tidal volume changes are there. So any respirations having tidal volume changes, always with apnea of 10 seconds, then you have to think about Cheyne-Stokes breathing. And it is obvious. I have seen lots of patients with cerebral hemorrhage during our intensive, during our final year students. We go across this Cheyne-Stokes breathing is very obvious in emergency, very obvious, right? So this is an abnormal type of respiratory pattern. So periodic breathing, physiological. Cheyne-Stokes breathing, abnormal and pathological. Clear? ঠান্ডা জল দাও না, দেখো না থাকে ওদের ফ্রিজে. So now other important pattern is in case of diabetic ketoacidosis. Have you heard the term diabetic ketoacidosis? Diabetic ketoacidosis means nothing. This is a type 1 diabetes patients, neglected patients or any resistance patients are coming and going up high sugar, and that causing the osmolarity changes, and that come landed into the metabolic acidosis. In my family, my friend's mother recently died by this diabetic ketoacidosis, but unfortunately diagnosed by me. I am not adult physician, but he called me. You please see my patients is doing something, vomiting. Is doing started vomiting. After doing vomiting and lying down in the bed, I just saw the Kushmal breathing. That is the point. That is called Kushmal breathing. That is called Kushmal breathing. Kushmal, M-A-U-L. Kushmal's breathing. It is highway now breathing. Okay, so Kushmal's breathing is in case of specifically seen it is diabetes, in case of uncontrolled diabetes and diabetic ketoacidosis. এই ব্রিদিংটা কেমন করে হবে? এই ব্রিদিংটা হবে একদম র্যাপিড ডিপ ব্রিদিং অ্যান্ড দেন র্যাপিড এক্সপিরেশন, এইভাবে করছে। দ্যাট ইজ, তাহলে এই যে সাইজটা হয়ে যাবে তখন এইরকম, রাইট? এবং কন্টিনিউয়াসলি বাড়তে থাকবে, কমার কোনো ব্যাপার নেই। বোঝা যাচ্ছে? সো টাইটাল ভলিউম হচ্ছে মোর। One important clue was there for my friend's mother was the smell. Smell means ketone smell. একটা বাজে কিটোনসের গন্ধ, যেটা আমরা শোনা আছে, আমরা শুনেছি। It will take time, but that is the main clue. I asked my friends, your mother is diabetic? Yes. Insulin, she missed insulin for last 7 days due to some family disturbance. She 90 rejects to take insulin injections in intradermal. So landed into Kusman breathing. Immediately I saw Nijao to the mission hospital. There are severe metabolism because vomiting was started 12 hours back. They are giving the pantoprazole, antacids and antiemetic drugs. They don't know what is happening here. This happening was here Kusman's breathing. So that's why this diabetic ketosis is emergency. It is emergency. It is emergency, and ultimately, after trying so many things are done and ventilator also, but she died within the 2 days. Because of that, the type of breathing is very much important to understand. The first type of dealing with that, and the smell. That is smell to me today also is my smell is remembering, because I have smell that sound in during my intensive. And some sorts of four children I have treated and saved as a diabetic ketosis. Diabetic ketosis is not only present in case of adult. It is an emergency for pediatric purposes also. I have saved at the early phases only the 4% with severe metabolic acidosis of this response breathing, and there's this ketone smell is very dangerous. So you have to advise of your family members, of your relatives, of your neighbor. By only the seeing the Kusman's breathing type of breathing, you have to send his or her to his nearby hospital to give insulin as well as fluids, as well as some sorts of another mechanisms are there. So potassium electrolytes disbalance will be there. So totally derangement of the electrolytes will be there in case of diabetic ketosis. We always prevent this. This is a medical emergency. This is a medical emergency, not surgical emergency. So Kusman breathing is like that. It's taking breathing like that. তাহলে ব্রিদিং আছে মানে সব ঠিক আছে তা কিন্তু নয়, রাইট? One is Cheyne-Stokes breathing, deep breathing, then shallow breathing, pause. Then deep breathing, more deep breathing, then shallow breathing, more shallow, then pause. So apnea is there, right? Now it is happening in case of, in this patient case Cheyne-Stokes. Suppose এটা যদি সেম হয়ে যায়, মনে করো সেম প্যাটার্নে হচ্ছে, এইরকম ভাবে হচ্ছে, এরকম সেম, দেন একটা পজ নিয়ে আবার সেম, মানে হোয়াট সেম ইন দিস অ্যাম্পলিটিউড আর ডেপথ অফ ব্রিদিং ইজ সেম, কোন রকম কোনো দেয়ার ইজ ডিপ অ্যান্ড স্যালো নয়, দেন ইট ইজ কল্ড বিয়র্ডস ব্রিদিং। দেন ইট ইজ কল্ড, যখন দিস উইল হ্যাপেন, ইট ইজ কল্ড বিয়র্ডস ব্রিদিং, অর এটার নাম আছে একটা ataxic breathing, right? Ataxic breathing or Biot's breathing. It is also mainly seen, it's not so common, in case of intracranial pressure, tension becomes high. Then this may happen in case of this Biot's. So Cheyne-Stokes and Biot's, parallel goes on, same amplitude with a pause. Apnea will be there. So that is called Biot's. তাহলে কি হলো? Periodic breathing, physiological, pathological Cheyne-Stokes, Biot's breathing, Kusman's breathing. বোঝা যাচ্ছে তো? So you and me, it's taking breathing. It is called normal breathing. What does it mean? What is called this? Medical term কি? Anyone? আমি তুই রেসপিরেটরি নিচ্ছিস, কোনো প্রবলেম আছে? কোনো ডিস্টেন্স নেই, কোনো প্যাটার্ন নেই, কোনো ঠিকঠাক যাচ্ছে, একটা সিরিজ রেসপিরেটরি নিচ্ছিস, দেন পজ অ্যান্ড দিস ওয়ান, দিস ইজ হ্যাপেনিং, দিস ইজ কল্ড ইউপনিয়া. Eupnea. We are in eupnea stage. apnea. So if apnea is there, then there is tachypnea. Tachypnea means what? Respiratory rate is high. There is a apnea, there is stoppage of breathing. তাহলে বোঝা যাচ্ছে ইউপনিয়া, ট্রাকিপনিয়া and also your apnea. Right? What is mean by orthopnea? What do you mean by orthopnea? Orthopnea. This is very important clinically also. You are seeing your patient whenever he is lying down, the respiratory distress is happening. But when he is in upright position, there is little bit respiratory distress is there. So respiratory distress is decreasing. So that is a changing of positions. Patient respiratory pattern change হচ্ছে, respiratory rate high হচ্ছে যখন শুয়ে দিচ্ছি, lying down positions. কি ক্ষেত্রে হতে পারে? Pleural effusions, cardiac failure, pulmonary edema. The exchange problem will be there, and so patient is come is orthopnea. So eupnea, tachypnea, apnea, orthopnea, it will come across in your book often and on from onwards. So orthopnea is a term, right? Apneistic breathing. What do you mean by that? Apneistic breathing. What do you mean by apnea? You know, there is a stoppage of breathing. Apneistic breathing means your center was there. What is the function of apneistic center? কে বলতে পারবে? Thank you. কে বলতে পারবে? What is the function of apneistic center? দেখ সব ভুলে কিরকম মেরে দিচ্ছে। হ্যাঁ, আমাদের যখন রেসপিরেটরি নিচ্ছি, দেখ আমরা সবাই নিচ্ছি, আমরা কিন্তু ইনভলেন্টারিলি ইন্সপিরেশনের পরে আবার এক্সপিরেশন নিচ্ছি তো। There is something is there in the neural control and brain which momentarily is suppress the inspiration. সেটা কি? নিমোট্যাক্সিক সেন্টার। নিমোট্যাক্সিক সেন্টার হচ্ছে সুইচ, এটা সুইচ, ঠিক আছে। অ্যান্ড অ্যাপনেস্টিক সেন্টারের ইনফ্লুয়েন্স হচ্ছে ওই নিমোট্যাক্সিক সেন্টারটাকে। ভাই তুই অফ করে রাখ, তাহলে ও অফ, নিমোট্যাক্সিক সেন্টারকে অফ করছে, ও অফ হয়ে গেলে কি হবে? এখানে কি হবে? অ্যাপনেস্টিক ব্রিদিং কেমন? এক্সপিরেশন ফেজ ইজ লেস, তাহলে এক্সপিরেশন ফেজ ইজ ভেরি ভেরি লেস। তাহলে কোন মনে কর আমার ইন্সপিরেশন নিচের দিকে করলাম আমি, ইন্সপিরেশন নিচ্ছে, so this is your expressions part, your expressions part is less. So whenever it's dealing with inspiration is much more longer and very short period of expressions, that is called apneistic breathing. You know হবে? তাহলে trapping of air will be there. বোঝা যাচ্ছে? So if trapping of air will be there, this patient will cause the carbon dioxide retentions. So that is called your, what does it mean? It is called apneistic breathing. So there are lots of types of breathing are there all over in your first year classes, and too much clinical applications are. This is your pattern of breathing which you can diagnose easily. You can diagnose easily by seeing only the patients, especially in case of Cheyne-Stokes and your Kussmaul's breathing. Very, very common. Very, very common. If you see some emergency patients in your emergency or OPDs in the emergency room that is come with a head injury, you may see that such type of Cheyne-Stokes of breathing. That will what happen? There's a deep breathing and then decreasing shallow breathing, then pause. Then deep breathing, gradually increasing deep breathing 2 or 4, then shallow breathing, then pause. Right? Shallow breathing means decreasing the depth, means tidal volume is decreasing. First increasing, then decreasing, then pause. Such type of patients is mainly for your traumatic. And this Biot's ataxtic is determinations or idea of something having medullary center dysfunctions. Medullary যদি কোনো problems হয়, then these Biot's or ataxia breathing, Biot's or ataxic breathing. Ataxic breathing is another name. তো এটা ঘাবড়ে যাস না যদি কখনো MCQ পাস। MCQ is very common from the pattern. It can say like that, a 50-year-old man is coming with first deep breathing, then shallow and 10 seconds pause, 10 seconds of apnea, which of the following condition may happen, which of the condition is similar to the pattern of these respirations? Number one choice is your diabetic ketoacidosis. Number two choice is your suppose pulmonary edema. Number three choice is your cerebral strokes, and then number D is all of the above. What is your choice? C. That is your cerebral strokes or your ischemic attacks will be the such type of MCQ will come. Kussmaul's breathing also. What does it mean? The deep breathing, highly deep breathing, taking lots of air and rapidly expirations is going on, having a smell of ketones seen in বলে এরকম করে মনে করে দিল diabetic ketoacidosis, uremia, pulmonary hemorrhage, both A and B. Both A and B. Because Kussmaul's breathing is also present in case of renal tubular acidosis. Right? Kussmaul's breathing not only characteristic for diabetes ketoacidosis is also present in case of renal tubular acidosis. I have seen lots of patients I have seen with the renal tubular acidosis. Patients come with renal failure, uremia, such type of breathing may happen due to acidosis mainly. So you have to cope up with the acidosis. Metabolic acidosis is dangerous for life. Respiratory alkalosis we can change by increasing or decreasing our ventilations. We can change that. But metabolic acidosis we also can change. But metabolic acidosis is totally derangement of the total environment of the cells, internal each and every cells of neural as well as every cell organs is damaged by the long-term metabolic acidosis. Something it is irreversible that happens in case of my friend's mother. It's very unfortunate. Only the age was only the around 65. So he is quite okay till she is taking the insulin is okay. Due to some family dispute, he rejects to take that. The family members also neglect that, and then starting increasing the sugar, osmolality changes, and then intracranial pressure high, and then it causing the what? Vomiting. So vomiting does not mean always your acidity, etc., etc., etc. Vomiting is your maybe your CNS cause. So be very alert. Whether patient is suffering from vomiting, it's not due to any GI symptom or any sorts of your CNS problems is going on. So not only that the GI symptoms, always the vomiting, abdominal pain, it's not only that GI symptoms. That's my take-home message from this lecture is that so whenever patient is dealing with vomiting problems, always search some respiratory pattern. And in case of newborn and infant, periodic breathing is absolutely normal. Don't panic about that. Now, তাহলে একটা জিনিস পড়ে দিতে পারি তোদেরকে, টাইম তো আছে অনেক। So what will happen if anybody drowning? It's very interesting. Drowning. কে সাঁতার জানিস না? আমিও জানি না। অনেকেই জানিস না, অনেকে জানিস। Very good. Swimming is very good exercise. Always I learned this. Anytime you can face this. I have faced in one that is a river rafting in the Pelgam in the previous year also, and fall down by the river rafting. কিভাবে কি করলো ডুবলাম, but that is the first rescue was there. So I was basically near drowning phase. Okay, coughing was there, lots of snitching was there, and some sort of respiratory pattern is changed. So if it takes more 1 to 2 minutes, it is dangerous for me. So swimming is very important, whatever it may be sea or ocean or river, in the swimming pool also. But drowning is very interesting, and drowning patients may came across in any emergency patients they have come. They will regularly come, তাড়াতাড়ি নিয়ে আসছে. So you face this. যে হ্যাঁ ডুবে গেছে, জলে গেছিল স্যার, খেলতে গেছে. And who are the risk factors? First of all, who are the risk factors? Almost the children, kids are the risk factors are there. Over enthusiastic like me, we don't know swimming, and then go the dangerous river rafting was there. My sons know the swimming, so he started swimming and escaped. He's a 5-year-old only, and I am trying to whatever is going on in the practical phase, whenever in sink, then we will try to push my leg and this way, and then again downing and downing. And so the term has come submersion and immersion. What does it mean? So that is come as a submersion and immersion. So this was my phase. I was submerged. What does it mean? That my breathing apparatus like nose, our whole body was underwater. And immersion means at a bucketer মধ্যে তুই মুখটা চুবিয়ে দিবি। তোর মনে কর রাগ হয়েছে কারোর উপর কোনো বন্ধুর উপর, বাট না দেখেন না সিনেমাতে এরকম করে চুবিয়ে দিচ্ছে, বডিটা এরকম করে বাইরে আছে, দ্যাট ইজ ইমার্শন। Whatever it may be, WHO criteria of the definitions of the drowning is the respiratory difficulty or respiratory inability when a subject is in submersion and immersion due to the stoppage of breathing, right? WHO criteria means both are there. Please silent. So immersion is like that. Examples that your body is not underwater, only the face is underwater. But submersion is the whole body is underwater. So that is the main thing. And you may came across two unethical and illegal written in your books probably. That is, there is a change of fresh water and salt water. No difference at all. Remember that. Why I am coming? তোদের বইয়ে দেখবি হয়তো লেখা থাকবে যে drowning is a fresh water drowning and salt water is different. So they are claiming the salt water drowning is more dangerous than the fresh water. Not at all. Never. We should not give such conclusions at all. Because whatever it may be your cause, the cause is only happen for 3 to 4 ml of water only. Do you think that water when you are in the submersible stage, like me, এমন হয়ে গেছিলাম আমি, আমার সব জলটা কি লাংসে ঢুকে গেছিল? Not at all. Because water gets a acute laryngeal spasm, and that is why your epiglottis will help to close the laryngeal and air spaces. And most of the water goes inside our stomach, right? Problem is that লোকেরা দেখেছিস না, ইউটিউবে দেখেছিস পেটটা দিয়ে আচ্ছা করে করছে। No, not at all. Don't do this. Because whenever the pressure is stomach, the water may come, and during the coming to the passage that can aspirate. Problem is that aspiration, right? So these things very छोटे जिनिस but very important. So 3 to 4 ml of water only the matters. What does it matters? It goes inside the alveoli, right? It goes into the alveoli, and you will feel the choking. There are different formats of drowning are there, but 3 important things are there. That is a laryngospasm, that is acute laryngeal spasm, and that helps to prevent the further entry the water into বলে না যে আমার জল ঢুকে গেছে, পুরো লাঙে জল ঢুকবে না, কোনো দিন হয় না, বোঝা যাচ্ছে? So whatever you salt water or your fresh water, what does it matter? কিছু ম্যাটার করে না, because if it's salt water is dangerous, is really dangerous than the fresh water. If the amount of salt water enters into the lung, it's much more bigger, but does not practically happens. So that is a key point of this. Current ideas is that the fresh water and the salt water, even you may face such type of questions in some seniors also, but in practically you remember that there is no changes or pathophysiological changes of drowning as well as complications are not changed at all for the changes of pattern of water, that is fresh water or salt water. কিছুই না, salt water is present in electrolytes are much more high, right? So if it is electrolytes high, then there is a deficiency of the problem will be there. So that's why it is called that salt water. কি করবে? Salt আছে তাহলে জল টানবে, হ্যাঁ? If it is salt water, then what is happening? It is your alveoli, right? It is surfactant are there, হ্যাঁ? Then salt water চলে গেল, কে আছে এখানে? সোডিয়াম আছে, এখানে কে আছে? পালমোনারি ক্যাপিলারিস আছে, তাহলে এখানে পালমোনারি আর্টারি, ক্যাপিলারিস, পালমোনারি ভেন, এই তো। তাহলে কি হবে? সোডিয়াম কি হবে? এখানে জল এখানে টানবে কি না? তাহলে এখান থেকে প্লাজমা লিকেজ হবে, যেহেতু ওয়াটার ইজ দেয়ার, ওয়াটার ইজ হাইড্রোস্কোপিক, so that will turn, that is cause a pulmonary edema severely, But if it happens, the amount of sodium filled water must be very high, not less, not to 1 to 2 ml, 3 ml at all. But our entire drowning, suppose a patient is having a come with drowning of only the 2 to 3 minutes. That is drowning. 2 to 3 minutes is much more. অনেকক্ষণ. Do you think the water will enter your lungs? তাহলে আমরা যেটা বুকে দেখি that is CPR. We will do only the CPR because there is no pulse at all. So we can save the patient, not the pushing or coming out the water into this. Right? এটা আগে কেন করা হতো যে এতটাই জল খায় যে diaphragm cannot come down. আরে বাবা পেশেন্টের পালসই নেই তো পেটে চিপে কি হবে? So whenever you are dealing any patients like that, we always see the pattern of respiration whether present or not. Number one, মনে করো respiration নেই, but pulse is there. Then what should we do? We should do the positive pressure ventilation. মুখে mouth to mouth breathing, even presence of frothing. দেখেছিস ড্রাউনিং হওয়ার পরে অনেকে মুখ দিয়ে গেঁজা বেরোয়, কি সেটা কি সেটা এবার আসবে। তাহলে এখানে আমি কি বললাম, সারফেক্টেন্ট থাকে। এখানে যদি 1 ml ওয়াটার যায় তাহলে দ্যাট উইল ওয়াশড আউট। কি ওয়াশড আউট? সারফেক্টেন্ট উইল বি ওয়াশড আউট। হোয়াট দ্য ফাংশন অফ সারফেক্টেন্ট? Surfactant is to lower the surface tension. So then it will collapse. If it is washed out by the derangement, মানে কি হয় জিনিসটা, এই তো যদি আমার অ্যালভিওলাই থাকে তাহলে আমার এইখানেতে এই সারফেক্টেন্ট এইগুলো আমার ডিসপার্সড হয়ে যাবে। ডিউ টু দি ডিসপারশন that will cause the lowering, basically increasing the surface tension, and that is prone to collapse. If it is collapse, do you think the gaseous exchange will happen? No. The main problem is that due to the washing out your surfactant, then that will damage or the property of the lungs, that is your recoiling or prevent the collapsibility of the alveoli will not be prevented at all. So lungs will collapse, the alveoli will collapse to decrease the alveolar exchange. Problem will be there. Number one. Number two, ফার্স্ট স্টেজিং এ আমার জাল মনে করে এই যে আমার ক্ষেত্রে এটা হয়েছিল, কাস্তার্ম করলাম, প্রচুর জলও খেয়েছি, কাস্তার্ম করলাম, কাফিং, লটস অফ কাফিং ওয়াজ দেয়ার, স্টিচিং ওয়াজ দেয়ার, and wheezing started in my chest. So what does it mean? It means that the bronchial walls are stimulated, and that stimulation is come from the cilia movement আছে এখানে, that is preventing to enter the water. Beautiful. That is helpful. That is helping. So coughing out is there, and then I was conscious. I was totally conscious. I did feel that the pulse is there. So I was okay within the 5 to 10 minutes. But I will never go up without swimming training at all in the water. This lifetime experience is there. So swimming, those are not in learning phase. Learned that swimming. Learn this is a good exercise also. So swimming is very important. Anyway, so these three patients that come first stage within the 1 to 2 seconds or 15 seconds, 20 seconds come as a coughing only. অনেক পেশেন্ট আছে, স্যার প্রায় ডুবে যাচ্ছিল তো দেখলাম যে স্যার আপনার কাছে নিয়ে আসি একবার, তখন স্টিল হি অর সি ইজ কাফিং। সো অলওয়েজ ডু এক্স-রে because you don't know what changes is happening in his lung. So observation is must. Any drowning or near drowning, you have to advise 48 hours of admissions must. Don't that like that, bhalo ache cholo chhere di. No, never do that, because you don't know what kind of injury and what kind of washout of this alveoli taken place already. So that is the essential learning that could happen. If it is present is much more longer. তাহলে কি বললাম, ফার্স্টে হচ্ছে কাফিং, স্নিজিং, and then washing out of surfactant, and then now coming to the point that presence of pulmonary edema and frothing. If frothing টা যেটা বেরোয়, if anybody is coming with drowning with the frothing, that means pulmonary edema developed already. What does it mean? Because the vessels is the interstitial space will be short, and the plasma will leak Plasma will leak from the pulmonary vessels into the alveoli due to the pressure changes as well as damage of the surfactant. Collapsibility of the alveoli is there. So, pulmonary plasma will come into the alveoli to cause the pulmonary edema, and this fluid and this plasma mixes with the surfactant causing the frothing. বোঝা গেল? তাহলে if you get the frothing from the mouth of a drowning, that means already in the bad stage, a bad safe, because of the patient's is suffering from already pulmonary edema. That's why plasma plus surfactant equal to froth. বোঝা গেল? And if you see practically that the pulmonary frothing or pulmonary edema come as the color of কি কালার বলেছিলাম? Pinkish, or you can say bloody also because rupture of bronchial arterioles. বলেছিলাম তো এটা, সব ভুলে গেছিস. So this is the dictum and clinical deep diagnostic criteria that any patient with respiratory distress coming with the blood frothy like of breathing, like previously just last week আগে আমি একটা পেশেন্ট পেয়েছি, আমার বাড়িতে এসেছিল, frothy breathing with saturation is less than 75%, died basically pulmonary edema developed, come in late, pulmonary edema developed, and pulmonary edema is dangerous. If it is present, still you have to go for the positive pressure ventilations, right? Mouth to mouth positive pressure, back marks ventilations you have to do within the froth. এমন নয় যে frothing suctions. No, don't requirement of the suction of the frothing. আমরা কই না মুখে আছে এটা ভালো করে বের করে দিই, no, not like that. তাতে আরো frothing will increase. Suction is contraindicated in these patients. You have to go for the positive ventilations first, then you have to check the pulse, respiratory pattern. If pulse is not present, then CPR. What do you mean by CPR? Cardio pulmonary resuscitations. That is CPR. All we have to understand. এখানে CPR ক্লাস হয়, BLS TLS হয়েছে কিছু করা উচিত. Your first year, not only that, in case of adults, in your family members, all should do the CPR. Suppose আমি এখানে আজকে পড়ে গেলাম দুম করে, anytime that can happen. So one of your students must be learned the CPR. How the CPR can save my life. CPR can save my life if he or she knows the proper CPR. Only CPR, continuous CPR can save a life. I have seen, I have saved. Not many patients, 1 to 2 patients I have saved. Only the CPR, continuous CPR. ঘেমে গুড়ি যাচ্ছে একদম, পাড়াচ্ছে না হাতে, রিব ফ্র্যাকচার হয়ে গেছে এরকম হয়েছে, দেন অলসো কন্টিনিউ দ্য CPR. সো CPR শুড বি ডিন স্যারকে বা অয়ন স্যারকে একটু বলবি যে স্যার আমাদের BLS মানে বেসিক লাইফ সাপোর্ট, হ্যাঁ বেসিক লাইফ সাপোর্ট ট্রেনিং আমাদের কবে হবে বা কবে দেবেন, দেওয়াটা উচিত. আই থিঙ্ক সো. In case of adults, some Malakoins are there, and there is certified courses there. Only 1 day training is enough for you. How to deal with these such patients, and you can came across in this patient anytime for your career of your only near dearance. পড়ে গেল আমার কথা, টাচুর তোর বাবা মা কেউ দিদিমা কেউ একটা পড়ে গেল suddenly, and you are seeing there is no pulse at all. What do you do? Ambulance ডাকবো, ও আসবে, শেষ হয়ে যাবে, শেষ. Whatever it may be, others person will do. You have to do. You as a medical profession, you have to do the CPR properly. Proper CPR with their mouth-to-mouth breathing and can save. I saved my father few months back. That fall due to the vasovagal attack, stoppage of heart. I was fixed. Pulse was absent. CPR started by me, fell softly, then violently, then come. So the pulse is coming and then recovers. This is a low BP is fall. Suddenly medicines are taken by mistaken by 2 tablets. It's taken in the morning. I was there in any Wednesday, because Wednesday I come in 11. I was there. That happened in the 8:30. So if I don't know the CPR, being a doctor, that is very much unfortunate for that day. সেদিনকে আর বাবাকে ফিরিয়ে নিয়ে আনা যেত না. Think about only this. Learn with the thinking at this, that you can save your own family members by seeing a simple few steps and simple few some knowledges by taking interest on you and also all your, as well as your friends also. হোস্টেলে কিছু হলো, কেউ জানিস না সিপিআর, ইমার্জেন্সি তুলে চাংদোলা করে নিয়ে যাচ্ছিস, মরে ভূত হয়ে যাবে, কিছু করতে পারবে না, বোঝা যাচ্ছে? সো অ্যাট লিস্ট ইউ ক্যান সে ইয়েস উই ট্রাইড মাই বেস্ট। দেখিস না প্লেনে ট্রেনে অনেকগুলো ঘটনা তো বেরিয়েছে এখন রিসেন্টলি, হ্যাঁ, প্লেনের মধ্যে এয়ারপোর্টের মধ্যে they are doing, luckily যদি if any anesthesia madam was there, some Delhi was there, so he saved basically, he saved his life. Continuously CPR is giving on, how to give, why to give, how and what are the steps behind this. It's not so much tough at all. নিজের ফ্যামিলিকে নিজেকেই করতে পারবে। Anyway, so this happens in submersion and immersion. The difference between these two, whole body means submersion and only the face is the immersions, right? So respiratory difficulty during the during your drowning phase, that happens due to the bronchial tree irritations, bronchial mucosal irritations, surfactant washout, frothing, pulmonary edema. বোঝা গেল এইটুকু? This is your all over your the drowning phase are there. Now positive pressure ventilations, what does it mean? Mouth to mouth positive pressure ventilation you can give. As early as possible you have to evacuate the child or adult or anything. জলের মধ্যেই করতে আরম্ভ করলি তা না, জল থেকে বেরিয়ে নিয়ে আসতে হবে। হ্যাঁ, ইন দ্য গৌরীদেবী মেডিকেল কলেজ, কে জানে গৌরীদেবী মেডিকেল কলেজের নাম জানিস তো? শুনেছিস তো গৌরী মেডিকেল কলেজ? I was there for the 5 years and I have saved in emergency patients. Suddenly, unfortunately I was there in the emergency due to some other reason, but a drowning child was there. Drowning child was there and patients come without any pulse পাওয়া যাচ্ছে না। স্যার আসুন আসুন আসুন, দেখুন দেখুন আমার কি কাজ হবে, কি হয়েছে কি হয়েছে, জলে ডুবে গেছে। জলে ডুবে গেছে বলছে মানে আমার এই সিস্টেম ইজ অ্যাক্টিং অন দিস। কি দেখবো? ফার্স্ট এই পালস ইজ অ্যাবসেন্ট, কি করবো? সিপিআর and with positive ventilation. Now respiratory নেই, not only CPR, positive ventilation, back marks, একজনকে back marks, emergency officer, ventilation, immediate ventilations and put on mechanical ventilations. Believe me, বাচ্চাটা আমার মনে কত ইয়ে ছিল, খুব একটা ছোট ছিল না, and he saved. ওয়ার্ল্ডলিতে নিয়ে এসছে, probably near drowning ছিল, হয়তো 1 to 2 minutes was there, but pulse was absent, and there is a lots of pulmonary edema after that, but saved. Anyhow, that is saved with equipment. That is my big achievement one. That is another is a sand, বালি চাপা পড়ে গেছে, মানে বালি দিয়ে চলে গেছে। So during drowning, mud water mixed is dangerous. That can cause asphyxial death. Mud কোন একটা কন্ট্যাক্ট ডুবে গেছে কিন্তু তার মধ্যে প্লাস্টিক সব চলে গেছে। In that case, if it happens, so always we see the ABC. What is mean by ABC? A means airways, B means breathing, and C means circulations. Always any patients in unconscious, pulse নেই, কিছু নেই, always see the ABC. ABC না দেখে আমি কিছু করব না। পালস ABC ফটাফট চলছে, এমন নয় যে পরপর ভেবে চিন্তে নয়, পরপর চলে, then you can save the patients for drowning. So any patients with drowning, you have to check whether respiratory present or not. If it is coughing, means you are in safe zone. He or she will give some time. But if it is not pulse, respiratory, that is dangerous. How many times this happened? Pulmonary edema developed or not? If it is frothing, that is another danger stage. That means frothing means what? Plasma plus surfactant is equal to frothing. তার ফ্রদিং মানে কিন্তু অনেকেই বলে, যেটা অনেক বইতেও আছে, আমি দেখেছি লেখা, যে এটা ফ্রদিং হচ্ছে কেন না, জলটা যেহেতু এয়ারের সঙ্গে মিশছে তাই ওটা ফ্রদিং হচ্ছে। অ্যাবসলিউটলি রাবিশ। ফ্রদিং মিনস plasma leakage already happens into alveoli and is connected with the dislodged surfactant, and that mixes to form the froth. F-R-O-T-H, frothing, right? So frothing can come is a now nose and mouth. That means already pulmonary edema happens. So almost in these cases, you will now probably you can see some stages and drowning. But who are the risk factors? Children, kids, swimmers without proper knowledge, and then are cardiac issues, অ্যারিথমিয়া, পেশেন্ট অ্যারিথমিয়া আছে, পুকুরে গিয়ে সাঁতার কাটছে, হ্যাঁ, sudden problem will be there. Epilepsy. Epilepsy means epileptic convulsion will be there. So these patients are high risk. তাদেরকে কখনো সুইমিং করা যাবে না। তোদের মধ্যে যদি কারো এই ধরনের প্রবলেমস থাকে তাদেরকে সুইমিং করা নিষেধ, সুইমিং ট্রেনিংও নেওয়া নিষেধ। এনিটাইম দ্যাট ক্যান হ্যাপেন অ্যান্ড ডেথ। সাপোজ ইউ হ্যাভ এ প্রবলেম অফ এপিলেপসি, যেটাকে মৃগী রোগ বলা হয়, কনভালসেন মাঝে মাঝে হয়, ওষুধ খাস, হোল লাইফ ওষুধ খেতে হবে, জানিস, you are doing swimming and then in the water you are doing this, then what will happen? You will not struggle at all. You can't struggle at all. The submerged, totally submerged, and then water will enter into your lungs to some extent. তাহলে acute laryngeal spasm is very important. Acute laryngeal spasm is very important to know that all the waters does not enter into the lungs. Maximum water enters into your stomach, right? So any patient is drowning and seeing that he or she is coughing, but he is taking lots of water, don't try to push the abdomen and trying to the water to come out. During the coming out, that is a second danger phase will come, that is the aspirations. So aspiration, that means যে জলটা যায়নি সেটাকে আবার লাংসের ভিতরে পাঠিয়ে দেওয়া হবে। So that will cause what? That will cause dangerous. And another point is that fresh water and salt waters, nothing difference is there between these three patterns. And protective phenomena always will be there. আমরা যখনই ডুবে যাচ্ছি আমরা কি করি না, এয়ার হাঙ্গার, টানবো, এয়ার তো পাচ্ছি না, জল খাচ্ছি। That is going on. This is happening in a very short time. And after this one, this hypoxia will start it. And brain tissue will not work. Disorientations, collapse, unconsciousness will happen. Then again down and down and down. And death. If it is not evacuated rapidly from this stage. And rapidly means rapidly. So the positive pressure ventilation is essential. Many cases, not only that. মনে কর কেউ পড়ে গেল, মাউথ টু মাউথ ব্রিদিং, কোভিড হয়েছে কি হয়েছে ভুলে যাও, আগে সেভ করো, কোভিডে বাঁচা যাবে অনেক, বুঝে যাচ্ছি, ইউ ক্যান সেভ। সিপিআর লার্ন করতে হবে, ইট ইজ আওয়ার ফল্ট দ্যাট তোরা এখনো ফার্স্ট ইয়ার, এখনো সিপিআর নো ট্রেনিং ওয়াজ দেয়ার, বাট দোজ আর ইন্টারেস্টেড অন্তত বলতে থাক, সেটা আমাদের একটা ট্রেনিং দিলে ভালো হয়। Then training নিলে কি হবে, your confidence, and training is always the repeated after 1 year. বোঝা যাচ্ছে, it is a certified course, most of the cases it given for 1 year. আমার যদিও নেই, আমার সার্টিফিকেট নেই, but I know very better way in CPR. I have a 2 or 3 certified in the Apollo Gynecology Hospital, Kolkata, when I was in RMO. There's a rep with daily 6-month interval, that was a 6-month interval of the BLS. So in today's class, pattern of breathing may come as a short note. Apneistic breathing come as a short note or MCQ. Kussmaul's breathing, Biot's breathing, Cheyne-Stokes breathing, periodic breathing, all are very, very important for your MCQ as well as long questions, as well as in your explain why, right? And then the drowning. Next class will be our probably the last class. I will try to finish because CNS chapters are there. Sea diving. Sea তলায় যদি চলে যায় তাহলে কি হবে, আবার টুক করে উঠে চলে আসবো তাহলে কি হবে, রাইট? তো ডাইভিং রিফ্লেক্স, সি ডাইভিং কমপ্লিকেশনস and their treatment, and also the ascending problem, that means decompression sickness will be described.